How is an esophagus endoscopy performed? Imagine being able to see inside your body without surgery. That's what an esophagus endoscopy allows doctors to do. It's a common procedure used to examine the upper part of your digestive system, especially when diagnosing issues like ulcers or inflammation. During the procedure, a long, thin, flexible tube called an endoscope is gently inserted through your mouth and guided down your throat into your esophagus. This tube has a tiny camera and light attached to its tip, which transmits real-time images to a monitor, giving the doctor a clear view of the lining of your esophagus. Before starting, you'll usually lie on your side, often on your left, to make the process easier. Your vital signs, including heart rate, blood pressure, and breathing, will be monitored throughout to ensure your safety. To make the procedure more comfortable, a local anesthetic spray is applied to numb your throat, reducing gagging or discomfort. Additionally, you might receive a sedative through an intravenous line, which helps you relax. Depending on your medical situation, this sedation can range from being awake but relaxed to being fully asleep under general anesthesia. Once you're ready, a plastic mouthguard is placed in your mouth to protect your teeth and the endoscope. The doctor then carefully inserts the endoscope into your mouth, guiding it down your throat into your esophagus. You might feel some pressure or a sensation of something passing through your throat, but it should not be painful. As the endoscope advances, the camera sends live images to the monitor, allowing the doctor to look for signs of ulcers, inflammation, strictures, or other abnormalities that could be related to peptic ulcer disease. Sometimes, the doctor will gently introduce air through the endoscope to inflate the esophagus. This helps expand the walls, making it easier to see any issues. If any suspicious areas are found, small tools can be passed through the endoscope to take tiny tissue samples called biopsies. These samples are sent to a lab for further analysis, which can help confirm diagnoses like ulcers or rule out other conditions such as cancer. The doctor may also extend the examination into the stomach and the beginning of the small intestine, known as the duodenum, to check for ulcers or other problems in these areas. Once the examination is complete, the endoscope is carefully withdrawn. The entire process usually takes between 15 and 60 minutes, depending on what needs to be examined. Most patients recover quickly after the procedure. Since sedation is used, you might feel a sore throat, some bloating or gas afterward, but these symptoms typically resolve within a day. Because this procedure provides a direct view of the esophagus and nearby areas, it is invaluable for diagnosing ulcers, inflammation, and other issues. It also allows for biopsies, which are essential for accurate diagnosis and guiding treatment plans. In summary, an esophagus endoscopy is a safe, minimally invasive way to look inside your upper digestive tract. It involves inserting a flexible, camera-equipped tube through your mouth, under sedation, to help doctors identify and understand conditions like ulcers. If you're experiencing symptoms or need a diagnosis, your healthcare provider can determine if this procedure is right for you and guide you through the process. Always remember to consult with a medical professional for personalized advice and care.